Hi. Now, this is a live session on the rapid revision for any upcoming examination, whether it is INICET or FMGE. And this is regarding the general antimicrobials. The specific antimicrobials I'll be taking up in the next session. This is only about the general antimicrobials. So I hope that this is visible to you. And I've already covered the anti-cancer in the previous ones. So let's start with the few questions which already have been asked in the previous examination. So we'll be focusing on those exams and simultaneously revising the questions or the topics around those examinations or those questions, right? So chalo, the first one is, which of the following does not require a reduction in the renal failure? Whether it is vancomycin, whether it is gentamicin, whether it is doxycycline, or whether it is amphotericin B. Which of the following does not require a reduction in the renal failure? So, reduction किसको नहीं चाहिए in the renal failure? So the correct option here would be your doxycycline. So remember the point about doxycycline. Remember, yes, very good, Anda. This is about doxycycline. This is one tetracycline which is safe in renal failure. Okay? So this is one of the, yes, very good, Mutessa, very good, Arnav. Okay? So this is safe in renal failure that you have to know. Otherwise, tetracyclines as such are not recommended, in renal, but doxycycline is the only one which is safe in renal failure, especially the expired tetracyclines. What is the problem caused with the expired tetracycline? They cause a condition which is called as Fanconi syndrome. Okay? Fanconi syndrome. This is with the expired tetracyclines. So, but doxycycline exception. Otherwise, vancomycin, gentamicin, that aminoglycosides are very, very nephrotoxic. So is vancomycin and even amphotericin. All of these drugs require a reduction in the renal failure. So here actually is a list of the drugs, antimicrobial drugs which are safe in renal failure. So ये कुछ ऐसी drugs हैं, for example, ceftriaxone, cefoperazone, rifampicin, erythromycin. These are some of the drugs which are safer in, yes, Fanconi's syndrome, you can call that. Okay? So these are the antimicrobials which are, the antimicrobials safe हैं जो we can easily give in the renal diseases. Ceftriaxone, cefoperazone, tigecycline, rifampicin, erythromycin. ठीक है, ये सारी drugs you can see that they are safer in the renal failure. Right, so this is about this. So remember, ये इसमें पूछते हैं ototoxicity. I'll be telling you a list. I'll giving you a list of the toxicities associated most commonly with the general antimicrobials, and then we will see what all you need to know on those lines. Chalo, next, coming to the next. Mechanism of action of vancomycin is. Mechanism of action of vancomycin is. ठीक है, इसमें मैंने ऑप्शन नहीं दिया है, it's a fill ups, so it is just a fill up. Mechanism of action of vancomycin is. What does it do? Or let's say, which enzyme will it inhibit? Which enzyme will it inhibit? कौन सा एंजाइम इनहिबिट करेगा? यस, अगर vancomycin. Inhibits an enzyme, yes. Inhibits an enzyme which is, no, transpeptidase is beta lactams. So that is why I asked this. Transpeptidase is beta lactams, it is different. Vancomycin is not on the same target as the beta lactam. It inhibits another point, that is trans glycolase. ठीक है, trans glycolase. Transpeptidase हो गया आपका beta lactams. Okay, Transpeptidase is beta lac. Hope this is the confusion nahi rehni chahiye. There should be no confusion in this. Okay, I will give you. There was a this particular diagram has been asked before as an MCQ. So they have given you this diagram. So this actually diagram is from book called as BG Katzung, you know, pharmacology book Katzung. It's a reference book, good book, and usme ye diagram is there. And here they have given you all the mechanisms of cell wall synthesis inhibitors. Jitne bhi drugs hain which inhibit the cell walls. So all of this you should know because one or two have been asked. Vancomycin from itself has been asked, so it was asked in the exam. Now the target site, like, so here you know this is 1, 2, 3, 4, 5. So 5 target sites are given here. So they asked vancomycin is given or it acts on which target site. So your answer would be 4, not 5. This is the transpeptidase of beta lactams. So I'll explain to you what happens with each of this, because there is a chance they can ask you what next time they will give you. If they give you a same diagram, they tell you that let's say phosphomycin acts on which site, ठीक है, cycloserine acts on which sites, bacitracin acts on which site. So there can be a difference. Excuse me. And get some water. So let's go to first phosphomycin. Okay, phosphomycin we'll try and see what happens in phosphomycin. That's the first site. So phosphomycin क्या करता है? Phosphomycin inhibits the first step, and what happens in that first step is that it inhibits the formation of NAG, you know, to NAM. NAG and MAM, you know, NAG and NAM, you know that these are two building blocks of the cell wall of the bacteria, NAG and NAM. So UDP-G to UDP-M. So ये block करता है, that is phosphomycin. And in this also there is an enzyme which is present, enol pyruvate transferase. Enol pyruvate transferase. ठीक है, so this phosphomycin inhibits this particular enzyme. So the first step is blocked, doesn't inhibit the conversion of UDP-G to UDP-M or NAG to NAM. So yeah, this you should know. This is the first step, phosphomycin. Number 2 is another drug which is your cycloserine. Now what happens, or what does cycloserine do here? Now cycloserine, you know, now when UDP-N or NAM, it is formed, it consists of, there should be 5 amino acids. ठीक है ना? 1, 2, 3. First 3 are not very important, but the last 2 are more important, which is your D-alanine. They need to be attached here so that the cell wall can be formed. So this D-alanine is very, very important here. Now D-alanine को बनने के लिए, to form D-alanine, it requires to be synthesized from L-alanine. L-alanine से D-alanine बनता है, and the enzyme here is racemase. Okay, racemase is an enzyme which is responsible for conversion of L-alanine to D-alanine, and if this D-alanine is not formed, then this UDP wala, the whole the 5 amino acids won't be there, and you know, when D-alanine is not there, there won't be any synthesis of the cell wall. So this enzyme is blocked by cycloserine. That is your step number 2. So whether they ask you the enzyme name, whether they give you this diagram, okay, the answer you should know. Coming to the third step, that is for the bacitracin. ठीक है, bacitracin. Now bacitracin के लिए, so you note there, I will show you with another color. See here, this is BP, BP, BP written. If you see here, ठीक है, this BP, BP written, and this BP is bactoprenol. ठीक है, bactoprenol. Now, what is the role of this bactroprenol? It binds this UDP is bound to this bactroprenol, and agar yahan dekhe, this bactroprenol, it flips it to the outside. Now, this is the membrane, this is the cytoplasm. So, all this is first happening inside, in the cytoplasm, then it has to go outside. So, to flip it out, we require this bactroprenol. वो उसको सारा the UDP's whole complex, it takes it to the outside and then it flips it out, वहाँ पे लग जाएगा, and then this BP again gets recycled back inside. ठीक है, so this BP comes back inside and then it will continue doing the job. Now, bacteria only have some amount of BP. They don't have a exhaustive store. They have like a huge store. They have some amount of BP only. So, bacitracin basically inhibits this BP, bactroprenol. So, it will not allow the flipping of this whole complex outside. So, therefore, the cell wall is not going to be synthesized. So, that is the third step which is affected by bacitracin. Then comes your fourth step, and wahan pe you have your vancomycin. Now, what does vancomycin do? So, we've discussed the enzyme, but what actually here we'll try and see here what it does is, it binds here somewhere to the D-ALA group. It just binds to the D-ALA group. In the UDP, NAM में जो last D-ALA, it binds to that D-ALA group and definitely will not allow any further action. D-ALA जब covered रहता है, it is involved in the cross-linking, so that is not going to occur. But its enzyme is different than the beta-lactams. Then you have your beta-lactams at the step number 5. So your PCM or paracetamol, you remember, which is your penicillins, which is your cephalosporins, which is your carbapenems and monobactams. Okay, so these are all your beta-lactam group of antibiotics. Okay, so what they do is they inhibit the transpeptidase. So they will inhibit the transpeptidase enzyme and they will not allow the cross-linking, because until and unless there is cross-linking nahi hoegi, the strength to the wall will not be there. So the wall will be very weak agar wo cross-linked nahi rahenge aapas mein, they won't connect. So that connection is with the help of an enzyme transpeptidase, and therefore beta-lactams inhibit the enzyme transpeptidase. So all of them will inhibit the enzyme transpeptidase. Okay? So this is the mechanism of all of them: phosphomycin, cycloserine, bacitracin, vancomycin, and then beta-lactam antibiotics. Just to remember it, और अगर इसको mnemonic की तरह याद करना है, from down to up, ठीक है, from नीचे से ऊपर जाने के लिए, you can remember there's a mnemonic, if you remember this story, like first हम cycle लेंगे, ठीक है, बाद में van, as your income status goes high, first is cycle, then van, and then Land Rover, right? So wall बढ़ती जाएगी, wall cell wall synthesis. So first step for phosphomycin, cyclosporine, बाद में is bacitracin, vancomycin, Land Rover. ठीक है, so first cycle and then gradually बाद में हम vancomycin and then Land Rover. So this is the step you remember, because this has been asked before. There are chances they might ask it to you in some other way. ठीक है, so this is the mechanism that you have to know. उसके बाद I would like to just highlight few important things about these antimicrobials, which is again important for bacitracin. ये हमने कर दिया कि ये inhibit करता है bactroprenol. ठीक है, that we have done. So it is only given topically for staph nasal carrier because it is very, very nephrotoxic drug. We don't give it by systemic route. Very, very nephrotoxic. Because of that, only given topically. ठीक है, topically ही देते हैं. Cycloserine हमने किया, that inhibits racemase. It inhibits the enzyme racemase, right? And it is given for MDR to tuberculosis, multi-drug resistant tuberculosis, and it has a tendency to cause CNS toxicity. So it can be in the form of seizures. ठीक है, even patients can develop suicide tendency with this drug. ठीक है, headaches and all that is there, but ज़्यादा जो grave है seizures, suicide tendency. Then phosphomycin. Phosphomycin is only and only used in the treatment of urinary tract infection. That is it. That's the only use of phosphomycin. Right? Inhibits enol pyruvate transferase, the first step. Hope this is what is usually more important for you to know. In तीनों के बारे में, that is more than enough. But vancomycin, it is commonly asked. So kind of time, just a few more important points about vancomycin because it is commonly asked. It is given orally or it is given IV. For which condition? So orally किस लिए देते हैं? Any guesses? Orally, for what condition do we give vancomycin orally? Because it doesn't need to be absorbed for this purpose. When you give it orally, it is given for what condition? Orally. Orally. Okay. Orally, will be given for, very good, Anna, pseudomembranous enterocolitis. It is given for pseudomembranous enterocolitis. IV, you can give it for, it is a drug of choice for methicillin resistant Staph aureus. ठीक है, MRSA. MRSA के लिए IV, orally for pseudomembranous enterocolitis. Most common side effect which is seen with vancomycin is maculopapular rash. Most common side effect, maculopapular rash. ठीक है? And there are some other side effects also. It is highly ototoxic, nephrotoxic, so therefore it needs dose reduction in renal failure. And जो popular question है with vancomycin side effect, that is your, yes, very good, red man syndrome. ठीक है, which is asked multiple times, and this is because of your histamine release. So there is a rash on the face, on the neck or the upper trunk, red man syndrome. ठीक है, but currently it is not a problem because now you know how to manage this. And how to manage this, you can give it slow IV infusion. IV infusion देना है, but slowly देना है, over a period of 1 hour, 60 minutes तक देना है. So if you give it but very slow IV, you can prevent this. And the other thing is, पहले you can give some antihistaminic. So now we know how to manage this. So if you give it slow IV or you give antihistamine prior, so you can manage or you can prevent this red man syndrome. And इसमें जो important चीज़ हमने देखनी है, this is because of the release of histamine and how to avoid or prevent this thing. ठीक है, now अब ये red man syndrome के around either the question can be directly, which is highly unlikely, कई बार directly नहीं भी पूछते हैं, so they can show you a picture of a red man syndrome. These are 2-3 pictures I could gather for the red man syndrome. So ठीक है, red man syndrome का हम pictures अगर देखें, what all you can see here, there is a rash either on the face, neck, ठीक है, or the trunk, upper trunk में. So any kind of, when you see such a picture, red rash है, maculopapular rash है, ठीक है, और the option में vancomycin है, ठीक है, option में vancomycin है, so then you can easily mark this is your red man syndrome, ठीक है, right. चलो let's go further. So this is about vancomycin. ये हो गया दो important points about this, ठीक है. Coming to now, इसके बारे में एक और हम ग्रुप डिस्कस कर लेते हैं alongside अभी cell wall synthesis inhibitors की बात की थी. Now just to see which are your protein synthesis inhibitors, ठीक है, the protein synthesis inhibitors, the ones which act at 50S and the ones which act as at the 30S ribosomes, ठीक है. So I think everybody knows there's a mnemonic which we know that by at 30, ठीक है, by at 30, cell at 40, या इसकी spelling of cells is, if you remember, CELS, cells at 50. If you, rather than SELLS, you remember this one. Sorry, I have a sore throat. So by at 30 and or cells at 50. So इसमें आपको what you need to know is AT, ठीक है. A stands for aminoglycosides, T stands for tetracyclines and your tigecycline, ठीक है. So this is by at 30. Then cells at 50, उसके लिए C आपका chloramphenicol, clindamycin, ठीक है. Your E is basically erythromycin, L is linezolid, S are your streptogramins. So remember cells at 50. Remember this spelling, CELS. Cells at 50, protein synthesis. So ये you should 30 पे कौन, 50 पे कौन, that is important to know. Then certain important points are chloramphenicol associated with gray baby syndrome, ठीक है, and it is associated with bone marrow suppression. Whether it is in some, it is dose dependent भी हो, type A भी है, type B भी है. Type B is idiosyncratic also, it happens, and type A is dose dependent. Dose dependent is less fatal. Type B जो होता है idiosyncratic is more fatal, ठीक है. And what else? Linezolid, if I say, it is the drug of choice for VRE, ठीक है, vancomycin resistant enterococci. ये important चीज़ है इसके लिए. Macrolides के बारे में, these are your basically enzyme inhibitors हैं, QT prolongation से associated हैं. These are certain important things about them. और इसमें जो पूछा गया है, tetracyclines I've discussed all of them except doxycycline. This is safe in renal failure. Aminoglycosides have ototoxicity, nephrotoxicity, neurotoxicity, so never combine two nephrotoxic drugs alongside, ठीक है. So these are certain things about protein synthesis inhibitors. So protein synthesis हो गया and your cell wall inhibitors. So come on, these are the ones, ठीक है. And you know all the cell wall synthesis inhibitors are उसमें मैंने जो पुराने slides में I just forgot that all of them are bactericidal except the cycle slow होता है, so they are static, ठीक है, except cycloserine. All of them are bactericidal drugs, ठीक है. That is an exception. Similarly, protein synthesis inhibitor, all of the protein synthesis inhibitors are usually bacteriostatic except, now tell me except, which of the protein synthesis inhibitors are not bacteriostatic but they are cidal? Exceptions are, you know, more important than the general, the regular things. All protein synthesis inhibitors are bacteriostatic except concept. One is aminoglycosides, yes, aminoglycosides, even streptogramins. ठीक है. So yes, streptogramins, aminoglycosides, so they both are static, sorry, cidal. And जो पुराने वाले में से cycloserine is one which is mostly it is static drug, and the rest all are cidal drugs, ठीक है. All right, dash is used in neurosyphilis. which drug is used in neurosyphilis? न्यूरोसिफिलिस में कौन सी ड्रग? Yes. Okay. So penicillin G. ठीक है, penicillin G is used in neurosyphilis because the other जो benzathine penicillin है doesn't have a good penetration. So इसमें again the important things now to know. Drug of choice for syphilis except neurosyphilis कौन सी है? Except neurosyphilis, which penicillin is a drug of choice in syphilis? Dash penicillin, which one? Yes, very good. Benzathine penicillin. So benzathine penicillin is a drug of choice for syphilis except neurosyphilis. So drug of choice for prophylaxis of rheumatoid arthritis is again benzathine penicillin. Longest acting penicillin is again benzathine penicillin. Penicillin G is a drug of choice for other conditions like legally active representative, और हम कर सकते हैं leptospirosis, ठीक है, actinomycosis and rat bite fever, ठीक है, these are important, ठीक है. Leptospirosis, actinomycosis, rat bite fever के लिए penicillin G is a drug of choice. And most common resistance mechanism, beta lactamase resistance. So beta lactamase resistance is the most common mechanism seen with penicillin, ठीक है. ये important कुछ points है. Benzathine penicillin, ठीक है, benzathine penicillin is important for prophylaxis. Yes, penicillase enzyme, beta lactamase, ज़्यादा common is beta lactamase. You can use the other ones also. More common, the most common अगर पूछा जाए. So this is your beta lactamase, ठीक है, that you can. Right. Now coming to the next one, ठीक है. So let's go on to your cephalosporins. Which of the following drugs can cause hemarthrosis? Which of the following drugs can cause hemarthrosis? Cefixime, cefoperazone, ceftazidime and cefepime. कौन सा cause करेगा hemarthrosis? Cefoperazone, very good. Cefoperazone, excellent. Cefoperazone, yes. Laluja, yes, yes Arnav, it is cefoperazone. So hemarthrosis, basically heme is blood, so there is bleeding. ठीक है, so they are actually asking, actually I cut short the question में दिया था, the patient goes on warfarin and then which of the following drugs started bleeding, कौन सा, we will not prefer. So I've just twisted the question, which of the drug can cause this. So anytime there is any bleeding and there is a cephalosporin given, you know that you have to answer about which of them is associated with bleeding. Now इसमें important चीज़ है, क्या याद करने की ज़रूरत है जो I want to highlight, they cause bleeding. Now what are the questions, ये हमें पता है, that is important question, but the reason for bleeding is another important question, which is reason is hypoprothrombinemia. ठीक है? That is a question. And then which of the drugs can cause or cephalosporins are associated with bleeding. ठीक है? सेफामेंडोल, ठीक है, सेफोटीटन एक हमने कर दिया, सेफओपेराजोन, सेफ्ट्राइक्सोन, moxalactam, right? These drugs can cause bleeding. They are associated with hypothrombinemia. So any of these drugs given in the option will be your correct choice of the drugs causing bleeding. ठीक है? And also the other thing, second is, you can remember, they also are associated with disulfiram reactions. Disulfiram reactions also, you can give the same answer, and as well as for the drugs causing bleeding. Okay, these are the important ones. So if you remember this Mandela, Nelson Mandela, when he gets hurt, उसको bleeding हो जाती है, ठीक है, so उसको हम tetanus का injection लगाते हैं, tetanus injection, very injection, and then we try to take him to operation theatre, उसको operate करने की कोशिश करते हैं, followed by giving lactam antibiotics. If you remember this story, you remember the drugs causing bleeding. ठीक है, Mandela is cefamendol, tetanus rhymes with cefotetin, ठीक है, tri rhymes with triaxone, ceftriaxone, operation means cefoperazone, lactam means moxalactam. So Mandela, जब when he gets bleeding, पहले उसको tetanus injection we give, then we try to operate him, उसके बाद we give him lactam antibiotics. ठीक है, so you can remember that way is also a story. And the same story will work for alcohol. Which of the cephalosporins should not be given to a patient who is consuming alcohol, or alcohol should be contraindicated or is contraindicated with which of the following cephalosporins? Answer would be the same. कुछ भी पूछेंगे, these are your main cephalosporins leading to this, right? Okay. So this is a picture actually of, in case they happen to show you a picture of hemarthrosis. So knee mein there is accumulation of the blood, so there is bleeding. So this is a picture which depicts hemarthrosis. So they can give you a scenario or a clinical case scenario जहाँ पे the patient presents with this and he was on a cephalosporin. So which of the cephalosporin do you think can be the reason for this condition? Okay, so again your answer becomes this. So whether it is in the picture format, images हो जाएंगी, whether they give you in a text format, any format, your answer remains the same. Okay, so that you just have to do that. Now let's here's a list of actually the important drugs and their toxicities. So that can be you can take a snapshot, or if already know, you can just revise this. Okay. So hypersensitivity is the most important side effect which is seen with your beta-lactams, sulfonamides, amphotericin. Especially these two have been asked before. Sulfonamides, any sulfur-containing drug has a tendency to cause a hypersensitivity reaction. Okay, so sulfonamides, beta-lactams, high chances of hypersensitivity. And you know the beta-lactams can cause any type of hypersensitivity reactions. Any type of hypersensitivity reactions. And there is a cross-sensitivity between the beta-lactams. Cross-sensitivity between the beta-lactams, except which of the beta-lactams can be used if there is let's say hypersensitivity reaction to penicillin. कौन सा use कर सकते हैं? Which of the beta-lactams can be used if there is, you know, let's say there is allergic reaction, patient को हो गया allergic reaction to penicillin. So which we cannot, which of the beta-lactams can be used still? Very good. Monobactams, Estrionam. It can be used because it doesn't show cross-reactivity. But currently, just remember, जो एक ceftazidime, so currently monobactums, there have been reports, they have shown some cross allergy with ceftazidime. ये क्वेश्चन था, ceftazidime, yes. But अगर ऐसा क्वेश्चन आया कि which of the cephalosporins has shown cross reactivity or cross allergic reactions with monobactums, then this should be your answer, ceftazidime. ठीक है, this is what you should know. Next you have phototoxicity, right? Common with demiclocycline, sparfloxacin, azithromycin. ठीक है, demiclocycline, sparfloxacin and azithromycin, right? So these are the three important drugs. Ototoxicity, aminoglycosides, vancomycin. Already discussed before, aminoglycosin, vancomycin. Nephrotoxicity. Now, aminoglycosides, vancomycin or ethambutol. These three drugs, you need to decrease the dose. ठीक है? Whenever there is a patient of renal failure or there is a decrease in the creatinine clearance, you have to decrease the dose of these three drugs. While the last two, they are contraindicated as such. Expired tetracyclines, as they say, they cause Fanconi syndrome, okay? So they can cause total shutdown and failure. So expired tetracyclines, cephalothane, cephaloridine, contraindicated in renal failures. Then drugs showing disulfiram-like reaction. So anywhere this is actually very important, disulfiram-like reaction. So इसमें एक mnemonic है, sorry papa can't go by metro. Sorry papa can't go by metro. So sorry papa में जो S आता है, basically S stands for sulfonylurea. So this is not antimicrobial, but just by the way, sulfonylureas, the first generation. Remember chlorpropamide, use नहीं करते उसको. Doxycycline, yes, doxycycline is safe. Only doxycycline, ठीक है? It is safe in renal failure. Apart from tetracycline, expired में है ना, expired you should not use. Expired नहीं use करना है, but otherwise doxycycline is safer in renal failure. Chlorpropamide, ठीक है? Sulfonylureas first generation, not the second one, the first generation, and we don't use anymore chlorpropamide now. P stands for procarbazine. Procarbazine, ठीक है? P stands for procarbazine, ठीक है? So sorry, papa, ठीक है? Then C is for cephalosporins. Cephalosporin, I already told you, वो जो हमने मंडेला वाला स्टोरी किया था, the same ones you can use here. Cephalosporins, ठीक है? G is for griseofulvin, which is your anti-fungal drug, ठीक है? M is metro. Metro is easy to remember. Metronidazole. These are few important drugs which can cause disulfiram-like reaction. Okay? Few drugs which can cause disulfiram-like reaction. So remember this mnemonic. Right? Very important. Please remember this one. Then hemolysis in G6PD deficiencies. Hemolysis in G6PD deficiency में remember sulfonamides again, or dapsone is a related drug. Primaquine, chloroquine, more tendency to cause this. Fluoroquinolone, some of them have caused hemolysis in G6PD deficiency. Especially these three are more important. Right? Hemolysis in G6PD deficiency. Redman syndrome we've already done. Vancomycin. बहुत बार, lot of times it has been asked. Bone marrow depression, chloramphenicol, anti-cancers, except, so remember the last time I told you, almost all the anti-cancers have a general tendency to cause bone marrow depression, except three drugs. Except three drugs which have a bone marrow sparing effect. ठीक है? So वो आपकी हैं L-asparaginase, ठीक है? Vincristine and bleomycin. Very good, Arnav. Yes. So all these three have bone marrow sparing effect. So chloramphenicol, anti-cancer, and one more you can remember, even linezolid. ठीक है, ये भी cause कर सकती है bone marrow depression. So ये तीन इंपॉर्टेंट होगी इसके लिए. देन हिपैटोटॉक्सिसिटी, लिवर के लिए ऑल ऑफ देम आर कॉन्ट्राइंडिकेटेड. एरिथ्रोमाइसिन, पीफ्लॉक्सिसिन, पायराजिनामाइड, टेट्रासाइक्लिन्स. So I'll be taking up next time when I take up the specific antimicrobials में we'll discuss the anti-TB drug. उसमें we'll see which of the drugs are safer and not safer. They're more important there. So अभी हम generally बात करें toxicities की. एरिथ्रोमाइसिन, पीफ्लॉक्सिसिन, पायराजिनामाइड, टेट्रासाइक्लिन्स. Neurotoxicity, again 2 A's, aminoglycosides and AMB, amphotericin B. Pseudomembranous enterocolitis, this is also very very important. ठीक है, pseudomembranous enterocolitis very very important. And इसमें आप clindamycin, cephalosporins, ampicillin and fluoroquinolones. ठीक है, clindamycin, cephalosporins, ampicillin and fluoroquinolones, they are जो अगर इसमें से जो टॉप मोस्ट आगा क्वेश्चन आता है विच इज द मोस्ट, एक्चुअली द मोस्ट है इसमें, cephalosporin has the maximum tendency followed by aminopenicillins like ampicillin and all. ठीक है, so pseudomembranous enterocolitis. And what is the treatment for pseudomembranous enterocolitis? Yes, we just did. Treatment for pseudomembranous enterocolitis, orally which drug we can give for this? That is your oral. अगर हमने देना है, you can give vancomycin orally, right? Because it has the oral action here. ठीक है, orally you can give vancomycin. So these are few important drug toxicities which are really really important and they have been asked time and again in various exams. ठीक है. Now, coming to the next question which was there, a child was admitted to the hospital with H. influenza meningitis. Cefotaxime is preferred over ampicillin here because cefotaxime is preferred over ampicillin here because cefotaxime is more active against beta-lactamase producing strains. Cefotaxime is cidal whereas ampicillin is bacteriostatic. Cefotaxime is more active against H. influenza, having altered penicillin binding proteins, or cefotaxime is easier to administer. What is the correct option? Yeah. So we'll look over the options here. See, cefotaxime is more active. Why was cephalosporin made basically? Why did we make cephalosporin? What are the problems seen with penicillin groups? The beta-lactamase, okay? So beta-lactamase was destroying them. So we had to have other agents which have more effect against the beta-lactamase producing strains, okay? So agar Cidal 4, no, even this is easier to administer, okay? The thing is, see, easier administration, there's no thing in, they both are easier to administer. There's nothing wrong in that. There's क्योंकि either you need IV route or oral route, जो भी आपको चाहिए तो they are easier to administer, ठीक है? So there is no way. अगर IV route में कोई मुश्किल, there won't be any trouble administering. Let's go to the option number 3. Cefotaxime is more active against H. influenza, having altered penicillin binding proteins. Now, beta-lactams, we did in the first diagram I showed you, they act the transpeptidase or the penicillin binding proteins, the target site is that. So if there is a problem with the target site, then neither your cephalosporins will be able to act there, nor your penicillin will be able to act there, nor your carbapenems will be able to be acting there. So any, the example, if you remember, methicillin resistant staph aureus, why have they emerged? Because they have acquired altered penicillin binding proteins. So none of these beta lactams can work against them. Now we have 5th generation cephalosporins, which are now seemingly effective against the MRSA, but otherwise, wherever there is alteration in the site where these drugs act, then none of them will be able to act. So this can't be the option, because cefotaxime will not function if there is an altered PBP. Neither will the ampicillin function. The second option is cefotaxime is cidal and ampicillin is bacteriostatic. That is also wrong, because all cell wall synthesis inhibitors, they are cidal. Static, they are not static, they're all cidal. So first option is left with us, which is cefotaxime is more active against beta lactamase producing strains. That is the correct option, because these cephalosporins, they work against these drugs or work against these organisms which are producing beta lactamase. Okay, so this is the correct option out of them. Understood? So this is the reason why this is the correct option and not the others. Okay, so a little preview, or just we'll quickly glance through what are certain important things about the cephalosporins, important from the examination point of view. We've already done the cephalosporins which show the adverse effects like disulfiram, or which show the adverse effects like bleeding tendencies. That is one point. और important चीज़ में क्या है, the first generation cephalosporins, they are more active against the gram positive aerobes. ठीक है, so they are more active against the gram positive aerobes, and the question जिसके बारे में which has been asked recently is on a drug called as cefazolin. Cefazolin, which is used for surgical prophylaxis, drug of choice for surgical prophylaxis. So this is important that you should know about the first generation, is one drug. Second generation is more about the anaerobic infections के लिए काम करते हैं, for anaerobic infections. So like cefotetin and, for example, cefoxitin, and like drugs. Third generation, they are most important. Third generation drugs, more common. They are more active against the gram negative aerobes. More effective against the gram negative aerobes, and they also have anti-pseudomonal action. So drug of choice for the pseudomonal action here is ceftazidime. Can give along with azithromycin. So ceftazidime is the drug of choice in anti-pseudomonal action. Okay? Then this is a very important drug, ceftriaxone. Okay? Another very important drug, and it's a drug of choice for gonorrhea. The question was asked in the last exam, the drug of choice for gonorrhea. So there is only single therapy. There is no multiple drug therapies for gonorrhea. Only single drug therapy according to the latest guidelines. So another question was asked that which of the following diseases do not require combination therapy? So the options were malaria, tuberculosis, leprosy, and this was gonorrhea. So the option is gonorrhea, because there's only single drug therapy recommended or drug of choice for gonorrhea, not any combination therapy. So this is the drug of choice for gonorrhea. Then meningococcal meningitis, ठीक है, enteric fever, then E. coli sepsis. Very well, all very good drugs for this. ठीक है. So ceftriaxone, cefoperazone, they are secreted in the bile. ठीक है, so the safer in the kidney function. So fourth generation में nothing much, just remember the name cefepime, cefpirome, so almost similar actions. Fifth generation में the important point is that it is effective against MRSA. That is the important thing here. It is effective against the MRSA. Right? So, make the cef. Yeah, fifth is this. So this is the only thing which is important. It is effective against the MRSA. That's the classic thing that you have. Ceftaroline and all drugs, ठीक है? Ceftobiprole and ceftaroline. So this you remember. So ये कुछ important features हैं, and this drug is very important. Ceftriaxone, then anti-pseudomonal action here, which is with ceftazidime, cefazoline, surgical prophylaxis. These are very meningococcal meningitis के लिए as the whole. This is absolutely important. Can't afford to forget this. So ये कुछ important points about the cephalosporins. Right? Okay. Let's go to the next one now. Drug inactivation through the enzyme. Drug inactivation through the enzymes is an important resistance mechanism seen with. Drug inactivation through the enzymes is an important resistance mechanism seen with. Can you name the antimicrobials? Just name the antimicrobials where the most common way of acquiring resistance is inactivation of the enzymes. Beta lactams. One is beta lactams, yes. Or remember here, yes, पर mnemonic है A, B, C. B हो गया beta lactams. A and C. A is for aminoglycosides. Okay. C is for chloramphenicol. ठीक है. A is for aminoglycosides. Okay. So these are the three important antimicrobials where inactivation is mostly, enzyme inactivation is the most common way of acquiring resistance. A, B, C. Remember this phenomena. ये है a table of you showing that different mechanisms which are common for different antimicrobials. ठीक है? So A, B, C is हमने किया this one. A, B, C. ठीक है? So these are very important ones. ठीक है? जो पूछे mine very good. Chloramphenicol, beta lactams. Yes, sir. So this is the one which has been asked. Another one which has been asked is about the efflux pumps. The most common is tetracyclines. ठीक है? So tetracyclines are important. इसमें efflux pumps are the main. उसके बाद erythromycin भी है, but this has been asked. So therefore, try to remember this at least. Then decreased affinity for the binding site. Decreased affinity for the binding site. It has been seen with mostly vancomycin, macrolides, fluoroquinolones. Vancomycin, macrolides, fluoroquinolones. ठीक है? Altered metabolic pathway is with one drug, that is your sulfonamides. ठीक है? Altered metabolic pathway has been seen with sulfonamides. and decrease in the cell wall permeability seen with penicillins, aminoglycosides. Penicillins and aminoglycosides. Penicillin का most common is this. This is the most common. This is the second type. But penicillin का अगर most common पूछेंगे, it is your inactivation by the enzymes. That is the most common seen with this. ठीक है? Penicillin का second is this one. Similarly, aminoglycosides, the common is breakdown by the enzymes. The second is cell wall permeability. So that you should know which is the most common, which is the least common. So इसलिए ये important drug resistance है with the examples, right? Okay. Now the next is, ये हमने वैसे I've already done this, but still treatment of choice for MRSA is, what is the treatment of choice for MRSA? Very good. Vancomycin. So it is vancomycin. So MRSA होगा, then you give vancomycin. But अगर VRSA हो जाएगा, then very good, Kishore. Yes, vancomycin. MRSA means vancomycin. So if there is VRSA, then another sin is there. MRSA करने के लिए one sin is van, और VRSA करने के लिए another sin. No, linezolid is for VRE. Drug of choice for VRSA. Sin. It is very good. Yes, daptomycin. Yes, daptomycin. ठीक है? So ये remember, ये चीज़ ये याद रख लेना. MRSA के लिए vancomycin, and if there is VRSA, there is a daptomycin there. ठीक है? उसको डांटने के लिए. And VRE के लिए we have linezolid. This is quite often. These are the drugs which are actually used for MRSA. As I said, vancomycin. Drug of choice is vancomycin, which can cause red man syndrome. ठीक है? So this has been asked before. Yes, daptomycin. Yes, Kishore. Very good. Other drugs are linezolid. There are other drugs. You don't have to remember the other drugs. Mostly it is the drug of choice which is asked. ठीक है? Then VRSA के लिए drug of choice, always remember drug of choice, which is your daptomycin, right? Then there is drugs for pseudomonas. ठीक है? अब drugs for pseudomonas है. Drug of choice for pseudomonas. Drug of choice for pseudomonas. There are a lot of drugs, but अगर drugs of choice की बात करें, which is the drug? Cephalosporin अभी हमने किया था, which is the preferred drug of choice for pseudomonal infection. Ceftazidime, ठीक है? Usually it is given along with the aminoglycoside. ठीक है? Along with the aminoglycoside, it's a drug of choice actually. Ceftazidime along with, can give along with the aminoglycoside. ठीक है? Then we have other drugs which can be used for this particular pseudomonal infections. we have colistin, polymyxin B, that can also be used. ठीक है? Ciprofloxacin, levofloxacin can also be used. Yes, this is the drug of choice. ठीक है? Then beta lactams में we can use carbenicillin, right? We can use ticarcillin, ठीक है? We can use piperacillin, we can use azlomaslocillin, ठीक है? These can be used. We can use carbapenems also, ठीक है? Monobactams can also be used. And we have the cephalosporins we've already discussed. Cephalosporins. Wait. Mostly हमें drug of choice पता होना चाहिए, which is your ceftazidime. Then they can ask you anti-pseudomonal penicillins. These ones. ठीक है? So these you should know. Anti-pseudomonal penicillins. Then anti-pseudomonal in cephalosporins. ठीक है? Ceftazidime, cefoperazone, that can also be used. Even cefepime, cefpyrome, 4th generation वाला भी use कर सकते हैं. ठीक है? So these are the important ones. 4. ठीक है? Ceftazidime, cefoperazone, cefepime, cefpyrome, they can be used. And then you have to know this one. Very very important, you know, drug of choice. So ये आपके pseudomonal. So MRSA, VRSA, VRE, anti-pseudomonal, all of them are important here. ठीक है जी? So just this one, gentamicin, mechanism of gentamicin induced ototoxicity. What is the mechanism of gentamicin induced ototoxicity? So gentamicin, we know it's an aminoglycoside, ठीक है ना? It is ototoxic, it is nephrotoxic, it is neurotoxic. ठीक है? Very good. Direct hair cell toxicity. ठीक है? इसमें ज़्यादा डिटेल नहीं, only know this. आया था एक बार, इसको ऐसे याद कर लो, direct hair cell toxicity. It is important. ठीक है? aminoglycosides इसमें आपको ये याद रखना है. दूसरा question, this one. Clostridium difficile diarrhea is most commonly associated with, out of them, macrolides, carbapenems, it should be penems, hold down, aminopenicillins or fluoroquinolones. Clostridium difficile diarrhea is most commonly associated with which of them? So we did the drug causing pseudomembranous enterocolitis, ठीक है? So Clostridium difficile, it's just like that. So the question can be either ways can be asked. So इसमें the correct option is your, out of them the most common is aminopenicillins, but otherwise no, it is aminopenicillins, but otherwise अगर एक और ऑप्शन आ सकती है, थर्ड जनरेशन cephalosporin अगर आएगा कोई भी, that is more likely to cause even as compared to aminopenicillins. ठीक है? aminopenicillins notorious हैं, but third generation सबसे ज़्यादा, फिर aminopenicillins and all. So they won't go beyond that, but सबसे ज़्यादा common ये. So drugs causing pseudomembranous enterocolitis, Clostridium difficile, सब में यही ऑप्शंस आपको पूछे जा सकते हैं. And then, as you know, I've already discussed, again I'm telling you, the treatment is, we can give vancomycin oral only. Please remember, agar there's a question, treatment of Clostridium difficile और उसमें options हो vancomycin oral, vancomycin IV, so you will tick the vancomycin oral. ठीक है, never IV, oral लेंगे. Then we can also give metronidazole. ठीक है, so these are the two, vancomycin, metronidazole. We can give rifaximin also. ठीक है, rifaximin दे सकते हैं, right? So these are the drugs commonly which are used for Clostridium difficile diarrhea associate, any of this. ठीक है, so remember this. So this last slide is, you can just see which are the important drugs of choice which have been asked, and that I have tried to. Yeah, that's, yes, you can also use fidaxomicin. Also we can use drug of choice fidaxomicin currently. Okay, just check on that, because I was thinking, just confirm that it dekh lo. I think it's vancomycin only, but still okay, you can see. Drug of choice for this. Now these questions have been asked here. Scrub typhus को पूछा गया है, ठीक है. So drug of choice is tetracyclines here. We can write doxycycline. All right, got that. Tetracyclines, ठीक है. Scrub typhus, doxycycline, got it. Diphtheria prophylaxis, erythromycin. Surgical prophylaxis already asked also, अभी discuss किया, cefazolin. Rheumatic fever prophylaxis, benzathine penicillin. Okay. UTI prophylaxis, cotrimoxazole. Meningococcal meningitis prophylaxis. ठीक है, all right Arnav, thank you for the ciprofloxacin. ठीक है, meningococcal meningitis prophylaxis is ciprofloxacin. ठीक है. Treatment, drug of choice is your penicillin G. Empirical treatment, ceftriaxone. ठीक है. Treatment, drug of choice, penicillin G. Empirical treatment, ceftriaxone. Prophylaxis, ciprofloxacin. All right. Anaerobic infections, metronidazole. Mycoplasma, azithromycin. Gonococcal or nonococcal, anything, you have to give azithromycin. So these are few drugs of choice. So there are so many which is difficult to put everything because वो आपको याद ही करनी है. But ये जो पूछे गए हैं repeatedly, so I've tried to put them here. Otherwise, like, there will be a huge list of drugs of choice that you will have to do. But the ones which have been asked in the previous papers, I've tried to put those over here, and the rest we've discussed in various questions, right? So these are the few important drugs of choice that you must be prepared with and go when you're going for the exam. So okay, so I hope you already have made a list of various drugs of choices, because these are the most volatile things that you tend to forget. So try to revise these drugs of choice often on, because and कई बारी ऐसा होता है, they ask you in the exams, rather than asking you the common thing, they ask you the exception. All of these can be used in this particular disease except. Okay, so that also, so they want to see which all you know. So that is also another trick there. So try to see, visualize. तभी I gave you a list of MRSA drugs and VRSA for the same reason, that all of them, they are used in those disease conditions except अगर दे दिया. So these you should not say that कि वो ये use नहीं करते हैं. So drug of choice is also one option. The other way is all of them are used except this, right? So ये हो गई about a little bit in concise about the general antimicrobials. ठीक है. So next time I'm going to take up the specific antimicrobials, which will include the rest which is left, except the anti-cancers, which has already been done, of course. ठीक है. So whatever the slides, whichever, I hope you could find some use of this, and because these are actually based on PYQs only. ठीक है, previous year questions only, so you can this way you can revise previous year questions along with some added points that I tried to put in, so that you can benefit from this, right? ठीक है. So that's it about this lecture, and next weekend I will be taking up the another one. उसके बाद में we'll do certain random PYQs, mixed bag हम करेंगे, so PYQs from the previous papers. So let it be just a revision, just of whole of the pharma, जितना भी we can cover, as many, so it won't be a specific topic, but then we'll try to just revise PYQs as such in the last week, maybe around 29th or whatever that date is of this month. So we'll give one more week to specific antimicrobials, and then that base. ठीक है? All right. Thank you so much. So I'll end the session here. If there is any anything that you want to add, if it's so, otherwise we can just wrap it up. ठीक है? All right. Thank you so much.